Hi, this is Linda. Today I wanted to talk about why 85% of North Americans experience low back pain and reoccurring back pain. So my little friend Skelly, he's our studio mascot here. He's going to help us learn why that is the case. So when we look at the spinal column, we can see here the cervical spine. It runs from the base of the skull basically to that bump that you would feel just at the bottom of your neck. And you could see here how small our little vertebra are. And then when we look at the thoracic spine, the vertebra gets a little bit bigger, but we also have our rib cage that attaches to every vertebra that's in the thoracic spine. And then this region here is our lumbar spine, what we would refer to as our low back. And then this part here, of course, is our pelvis from the back side. So 85% of North Americans experience low back pain, and it's usually referred to pain in the lumbar region, but can also refer to pain in the pelvis or in the side hip. So why is that so? First off, as I've already pointed out, the vertebrae in the neck are much smaller because really all they're doing is supporting our skull, our head. But as we move down and the vertebrae gets bigger, we're needing bigger bones because the low back and then to the pelvis are supporting 2/3 of our body weight. So there's a lot more load in the low back than there is, say, in the neck. The other thing that distinguishes the low back region is the fact that we have a lot of support in the neck, supporting this shorter area. We've got our musculature, we've got all of our tubes for breathing and swallowing food. In the thoracic spine here, we've got, again, the bones, the structure of our rib cage and our sternum. We have still, even though our scapula is floating, it's still a bony structure that wraps around to the collarbone in the front that's helping to provide a sense of stability to our mid-back. But when we look at the lumbar spine, the low back, there's nothing out front structurally that's supporting, helping to stabilize that area, yet it's carrying so much of the load of our body. So when we talk about strengthening our core to support our back, that's why we've got our abdominals out in front, we've got our obliques that helps to stabilize from the side. In the back here, we have our quadratus lumborum, and then we have all these muscles, the erector spinae and deeper the multifidi, that are also helping to stabilize the low back. So really, our control of support and controlling back pain is to have strength and mobility and balance in this area of our body. So if we're always standing tilted over to one side of our body is getting a little bit shorter and tighter, whilst the other side is continually being more lengthened and stretched out and not as strong. All of those things can put load on the low back, causing pain. So when you're told to strengthen your core, that's basically why, because that's all we've got supporting the lumbar spine. I hope you find that helpful, and thanks for watching. Have a great rest of the day.